Stop assuming your cat's dental exam is just an upsell for an expensive cleaning. That 30-second check is the most effective way to extend your cat's lifespan by years, catching systemic diseases while they are still treatable. I'm going to break down exactly what your vet is seeing in those gums, and why it's the ultimate key to keeping your furry friend healthy and pain-free. I've had owners sit across from me in the exam room, watch me pry open their cat's mouth for a few seconds, and ask, "Is that really necessary? Can't we just get to the checkup?" And I understand the impatience. Cats hate it, owners feel bad watching their cat squirm, and it looks, on the surface, like a formality. But that 30-second look inside your cat's mouth is not a formality. It is, in many cases, the single most information-dense moment of the entire visit. Today, I want to walk you through exactly why, what we're actually looking for, and how you can start reading some of these signs yourself at home. Part 1, the hidden diagnostic window. Let's start with a basic anatomical fact that changes how you should think about your cat's mouth entirely. The oral cavity isn't a separate, isolated structure sitting off to the side of your cat's body. It's a direct, unfiltered window into the internal environment. The gum tissue is thin, richly vascularized, and sits extremely close to the surface, which means changes happening inside the bloodstream show up there faster and more visibly than almost anywhere else on the body's exterior. Think of it this way. Your cat's skin is covered in fur, thick and built to hide almost everything happening underneath it. The gums have none of that camouflage. They're translucent, delicate, and directly exposed. When something changes systemically, oxygen levels, hydration status, red blood cell count, circulation, the gums often reflect it before you'd ever notice a change in your cat's coat, appetite, or energy level. This is exactly why the oral exam happens before we listen to the heart or lungs. It's not about priority in the sense of most important organ. It's about sequence and logic. The mouth gives us a fast, non-invasive preview of what we might expect to find elsewhere in the body. If I open a cat's mouth and see pale, almost white gum tissue instead of the healthy pink we expect, I'm already recalibrating my entire exam before the stethoscope even comes out. Pale gums can point toward anemia, blood loss, or poor circulation, and in some cases, that's an emergency-level finding, not a routine one. Similarly, if I see gums with a slight blue or gray tinge, that's a signal of inadequate oxygenation, something that could indicate respiratory distress or cardiac compromise. Yellow-tinged gums can point toward liver dysfunction or red blood cell breakdown. In each of these cases, the mouth told me something critical in seconds, something that would have taken much longer to uncover through blood work or imaging alone. That's the diagnostic efficiency we're chasing every single visit. The mouth as a fast access preview screen for the rest of the body. Part 2, the silent pain epidemic. Here's something that surprises a lot of owners. Cats are, biologically, some of the best pain concealers in the animal kingdom. This isn't stubbornness or toughness in the way we might think of it in people. It's an evolved survival mechanism. In the wild, an animal that visibly limps, favors one side of its mouth, or shows obvious distress becomes a target. For predators, for rivals, for anything looking for an easy opportunity. So cats have been shaped over thousands of years to mask discomfort as effectively as possible, right up until the pain becomes so severe that masking it is no longer physically possible. This means a cat can be living with significant dental pain, a fractured tooth, an exposed nerve, deep inflammation below the gum line, and still eat, still purr, still seem like themselves to the people around them. Owners often tell me, but she's still eating fine. She can't be in that much pain. And I understand why that logic feels sound. But eating and pain tolerance are not the same thing. Cats will often continue eating through significant discomfort because the drive to survive outweighs the discomfort of chewing, at least until the pain becomes truly severe. This is where advances in dental imaging have really changed the picture for us. Modern imaging techniques let us see below the gum line in a way that a visual exam alone never could. What we often find are resorptive lesions, areas where the tooth structure itself is being broken down and absorbed by the body, frequently starting at or below the gum line, where you'd never be able to see it just by looking in your cat's mouth. These lesions can be extremely painful, exposing sensitive inner tooth structures, and yet from the outside, that tooth might look completely normal. There's also something we refer to informally as phantom pain behavior. Subtle physical cues that most owners miss entirely, but that we're trained to catch during a hands-on exam. Things like a slight head tilt when chewing on one particular side, a barely perceptible flinch when we touch a specific area of the jaw, or resistance when we try to open the mouth fully on one side versus the other. None of these are dramatic. None of these would make an owner think dental emergency, but to a trained eye and hand, they're red flags pointing directly at a problem that needs immediate attention. Part 3, Systemic Connections to Vital Organs. This is the part of the conversation that tends to genuinely shock owners because it reframes dental health as something far bigger than just teeth and gums. The mouth is not a closed system. When gum tissue becomes inflamed, a condition we call gingivitis, which can progress into more serious periodontal disease, that inflamed tissue becomes permeable in ways healthy tissue isn't. Bacteria that live naturally in the mouth can enter the bloodstream through these compromised gum tissues, especially during chewing or any mechanical irritation of already inflamed gums. Once in the bloodstream, this bacteria doesn't just disappear. It circulates, and it tends to settle in specific places. Organs with high blood flow and filtration demands are particularly vulnerable. The kidneys are one of the most consistently affected. We've seen a strong correlation between chronic, long-standing gum inflammation and the earlier onset of feline kidney disease, one of the most common conditions we manage in senior cats. The theory is that repeated low-grade bacterial exposure from oral disease places additional inflammatory burden on kidney tissue over time, potentially accelerating the decline that many cats experience as they age. The heart is similarly at risk. Oral bacteria have been found to contribute to the development of certain cardiac conditions, including inflammation of the heart valves, in cases where bacteria colonize on already vulnerable cardiac tissue. This is part of why, when I hear a slightly abnormal heart sound in a cat with significant dental disease, dental treatment often becomes part of the broader conversation about protecting that heart, not just an unrelated side issue. The liver, too, bears part of this burden. It's the organ tasked with filtering and processing much of what circulates through the bloodstream, including the byproducts of chronic bacterial exposure and ongoing inflammation. Persistent oral infection means the liver is working overtime continuously for years, often without the owner having any idea this connection even exists. And there's a broader picture emerging as well, one connecting long-term untreated dental disease, not just to specific organ conditions, but to overall lifespan and even cognitive health in aging cats. Chronic inflammation anywhere in the body places ongoing metabolic stress on the entire system, and there's growing recognition that this kind of sustained inflammatory load may contribute to the cognitive decline we sometimes see in senior cats. The confusion, the altered sleep patterns, the behavioral changes owners often chalk up simply to getting old. Dental disease isn't the only contributor to that picture, but it's a more significant piece of the puzzle than most owners realize. Part 4, Financial and Medical Prevention. I want to be very direct about something here because I think it changes how owners approach these visits. That 2-minute oral exam is, without exaggeration, one of the most cost-effective pieces of preventive care available for your cat. Catching a problem at the gingivitis stage before it progresses into deep periodontal disease, tooth root abscess, or a full-blown systemic infection is the difference between a straightforward, relatively affordable cleaning and an emergency surgical extraction paired with hospitalization, IV antibiotics, and pain management that can run into the thousands of dollars. I've seen this play out too many times, an owner who skipped a few years of checkups because their cat seemed fine, only to come in with a cat who stopped eating entirely, running a fever, with a jaw so swollen from an abscessed tooth root that surgery becomes the only option, done on an emergency basis rather than as a scheduled, controlled procedure. The cost difference isn't small. The recovery difference isn't small either. A scheduled, early-stage dental cleaning is a same-day procedure with a fast recovery. An emergency extraction on an infected, systemically compromised cat is a completely different level of risk, cost, and recovery time. I also want to address something that's become increasingly common, at-home dental care trends that promise to replace professional cleanings entirely. Brushing, dental treats, and specialized diets absolutely have a role to play. And I'll get into the current recommendations in a moment, but none of them can address what's happening below the gum line. Professional cleaning under anesthesia allows for a full evaluation of each tooth, x-rays to see root structures, and the ability to actually remove disease-causing plaque and tartar from areas no toothbrush can reach. At-home care is a maintenance tool. It's not a substitute for professional evaluation. Catching something like a fractured tooth early on genuinely changes the entire trajectory of a cat's senior years. A fracture caught and treated promptly means a contained problem, extraction, or a root canal. Resolution, done. A fracture left untreated for months or years becomes a chronic source of pain and infection that can compromise appetite, weight, immune function, and quality of life for the rest of that cat's life. Part 5, the proactive owner's checklist. So what can you actually do between visits? The most useful technique I recommend to every owner is what we call the lip lift check. Gently lift your cat's upper lip on each side. You don't need to force the mouth open, and look at the gum line where it meets the teeth. You're looking for a few specific things: redness or a distinct red line right along the gum edge, any swelling, visible tartar buildup that looks like a brownish crust on the teeth near the gum line, or any obvious bad breath that's beyond normal cat breath. Any of these findings warrant a call to your vet, even if your cat seems otherwise completely normal. On the maintenance side, current recommendations continue to favor daily brushing with a feline-specific enzymatic toothpaste as the gold standard, never human toothpaste, which can be genuinely harmful to cats. For cats who won't tolerate brushing, water additives and specifically formulated dental treats carrying veterinary oral health endorsements can meaningfully reduce plaque buildup, even if they're not quite as effective as brushing itself. The real key here is treating your vet's findings and your at-home routine as two connected halves of the same system, rather than separate boxes to check. When your vet flags early gum inflammation at a visit, that's your signal to tighten up the home routine, not just something to note and forget until the next appointment. And when you notice something during your own lip lift checks between visits, that's your signal to call in rather than wait. That 30-second look in your cat's mouth isn't a formality, and it was never really about the teeth alone. It's a window into everything else going on inside your cat's body: kidneys, heart, liver, comfort, and years of life still ahead of them. Understanding what we're actually looking for is the first step toward becoming a real partner in your cat's long-term health, not just someone who shows up once a year for a checkup.